Georgia.
A farmer needed an extra hand, and he asked a stranger to help out. "What'll you pay?" asked Tony. "Whatever you're worth," said the farmer. "Don't think I'll work for that," he answered. "What are you worth to your community, your church, and your Lord? If you could buy some people at their real worth and sell them for what they think they're worth, you'd get rich. But what you are determines your worth. If you're loyal to the Lord, decent in your dealings, true to your trust, sincere in your speech, you're worth a lot. Be worth all that you can be, won't you?
For your free copy of Dr. Guido's daily devotional, Seeds from the Sower, write The Sower, Mentor, Georgia, 30439.
Visit us on the web at thesower.com.
VCY America presents Crosstalk, a nationwide call-in program discussing issues that have an effect on our families, our communities, our churches, our nation, and our world. Crosstalk, an opportunity for you to voice your concerns for biblical principles. And now live by satellite and around the world on the internet at vcyamerica.org. Here is today's Crosstalk.
And thank you for joining us on Crosstalk. Ladies and gentlemen, in my hands today is a press release from the office of Senator Ron Johnson of Wisconsin. Now, he is chairman of the Permanent Subcommittee on Investigations. And last Wednesday, he held a hearing titled Unmasked: How Biden Health Officials Purposely Turned a Blind Eye Toward COVID-19 Vaccine Safety Signals. It's a hearing that drew little media attention. Along with this hearing, Senator Johnson released a report of approximately 600 pages containing records that detailed how beginning in early 2021, FDA officials became aware of a new state-of-the-art data mining method that could better detect statistically significant safety signals for adverse events that was associated with the COVID-19 shots. But rather than adopt this method, the Biden health officials continue to employ their older data mining methods with known limitations that prevented FDA from detecting adverse events. Senator Johnson indicates that Peter Marks, who was head of the FDA Center for Biologics Evaluation and Research, he was treating vaccine injuries that were life-threatening injuries, and people were pleading with the FDA and the NIH to make this public, but never did do so, just turned a blind eye toward this. Senator Johnson indicated, quote, "We've got a real big problem in this country about vaccine injury deniers. Again, these vaccine injuries are real, but it's being denied." Well, while this hearing was far longer than a Crosstalk program, we're going to be taking you to this hearing to hear from Senator Johnson in his opening remarks. We're also going to be airing the ranking member, Senator Blumenthal, the lead Democrat on the committee, and also we'll hear as much from the witnesses as we can. So I would like to begin with this Senator Ron Johnson as he opened the hearing last Wednesday, April 29.
Good afternoon. This hearing of the U.S. Senate Permanent Subcommittee on Investigations will come to order. I want to first thank the witnesses for your time and effort in appearing here today for your testimony. In conjunction with this hearing, I am releasing an interim report titled Unmasked: How Biden Health Officials Purposely Turned a Blind Eye Toward COVID-19 Vaccine, or I call them injection, injury safety signals. I urge everyone tuning into today's hearing to read the full report to determine for yourself how the title is as accurate as it is incriminating. To set the stage for what follows, let me remind everyone that Dr. David Morens, now indicted for this, under conspiracy and destruction of records charges, he was an advisor to Anthony Fauci, emailed to colleagues on how to evade Freedom of Information requests. Quote, "I learned from our FOIA lady here how to make emails disappear, and how he wanted, quote, correspondence on sensitive issues to be sent to me at my Gmail address," unquote. Included in this report is additional evidence of how federal health officials avoided creating a paper trail to prevent transparency and public disclosure. In discussing how they've been warned of a major limitation of FDA's data mining system, one senior FDA official wrote, quote, "We should meet internally. many considerations not suited to email, unquote. Other federal officials appear to have openly acknowledged that they were actively attempting to avoid transparency. A CDC official discussing the sharing of vaccine safety data stated, quote, "I think because of the FOIAs, we may have asked FDA to stop sending these weekly data mining outputs," unquote. In spite of their concerted effort to conceal what they knew and when they knew it, documents we've retained, thanks to Secretary Kennedy's responsiveness to my subpoena and his commitment to radical transparency, paint a clear picture of an obvious cover-up by federal health officials. Our report shows how FDA officials were warned and fully aware of their safety surveillance system's inability to adjust for a statistical phenomenon called masking, which according to medical researchers occurs when, quote, "signals for a vaccine of interest are hidden by presence of other reported vaccines," unquote. Rather than use a newer state-of-the-art system that can adjust for masking, Biden health officials purposefully chose to employ the older system that conceals the signals for serious adverse events associated with the COVID injection. Throughout 2021, FDA officials received multiple analyses from the state-of-the-art system showing statistically significant safety signals for adverse events, but made a conscious decision to ignore that data. On October 22, 2020, CDC's Tom Shimbakuro touted VAERS by saying it can, quote, "rapidly detect safety signals and can detect rare adverse events," unquote. But in an email a year later, when VAERS was reporting worldwide adverse events of 837,595 and 17,619 deaths, Dr. Shimbakuro stated, quote, "It's not a database that should be used for serious surveillance and research." And we have up on the screen a chart that I produced almost weekly once I started tracking this. And you'll notice it compares different drugs, adverse events reported of those things, deaths per year. You can see at the top of the chart, ivermectin appears to be a pretty safe drug. At the very bottom, COVID vaccines, and again, this is in October of 2021. 17,619 deaths. It's important to note that 32% of those occurred either on the day of vaccination or within 1 or 2 days of vaccination. I know VAERS doesn't prove causation, but that is a correlation that federal health officials ought to be looked at. In reaction to the skyrocketing number of deaths and adverse events, other Biden administration and federal health officials were also publicly denigrating VAERS with comments like, quote, "falsified VAERS report, potentially misleading VAERS posts, frequently misused by anti-vaccine activists," and, quote, "conspiracy theorists, science deniers, and anti-vaccine activists can fill out the form." Now, this is quite honestly contrary to reports in terms of the high percentage that are actually reported by medical professionals. The federal health agencies had to be sued twice before a court finally forced them to disclose the results of the VSAFE system, an online self-reporting safety for surveillance system created specifically for the mRNA COVID injections. Here's why they fought so hard to keep that from public view. Of the 10 million people who voluntarily provided information to VSAFE, 7.7% sought medical care for COVID injection adverse events, and 25% lost time at work or couldn't perform their daily routine following injection. Even though I wrote 21 letters requesting information on what the agencies were tracking and what they knew about adverse events, I didn't need sophisticated mathematical models to tell me the COVID injection was causing significant harm. The data depicted on these charts alone should have raised the alert level to DEFCON 1. Now, this first chart is showing deaths reported on VAERS since the inception of VAERS. You can see starting in 1990, deaths were approximately a couple hundred per year, anaphylactic shock, those types of things. In 2021, deaths spiked to 21,631. Now, again, I didn't need a mathematical algorithm to tell me there's something going on here. And by the way, a lot of people will say, well, that's because we administered billions of doses. One of the letters I wrote to the CDC showed the rate of death per dose, compared it to the flu, which is about 0.46 deaths per million doses. Time we calculated this, the COVID injection was 25.5 deaths per million doses. That's a 55-fold increase over the deaths for the flu vaccine. So something was going on here. Our federal health officials should be paying attention. Let's do the next chart. This is the most up-to-date VAERS chart now. It's showing 39,077 deaths worldwide reported to VAERS. And understand, and we'll be adding this to the record, the Pilgrim report, an HHS-funded Pilgrim study at Harvard University showed that adverse events for vaccines are reported at less than 1%. So this grossly understates the number of adverse events and deaths, and you can see adverse events are almost 1.7 million. Multiply that times what, 100, 30? These are dramatically understated. In spite of these shocking numbers, federal health officials continue to recommend the injection, claiming it both safe and effective. By comparison, in 1976, after approximately 25 to 30 deaths and over 500 cases of Guillain-Barré syndrome, the swine flu vaccine was pulled from the market. Biden federal health officials were clearly not as vigilant in reacting to what VAERS was showing. For over 4 years, I have wondered how health officials could possibly ignore this overwhelming evidence of harm. Now I know. Our report details that on March 1st, 2021, less than 3 months after the COVID injections received an emergency use authorization, Peter Marks, the head of CBER, and officials reporting to him were warned by FDA's Dr. Anna Scharfman, and an individual who these officials recognize as an expert in FDA's data mining, that the current system would mask safety signals for COVID injection adverse events. Dr. Scharfman proposed a new model, a new method, invented by Dr. William Dumichel of Oracle, the inventor of the current algorithm, to uncover the hidden safety signals. On March 26, 2021, 26 days later, Dr. Scharfman sent Dr. Dumichel's data analysis to senior FDA officials, showing that the new analytical method found, quote, 49 examples of extreme masking and uncovered approximately 25 statistically significant safety signals of adverse events associated with COVID injection, including, let's put up the next chart here. Here's the sheet. These are the adverse events that they were showing a safety signal for using the new method: Bell's palsy, sinus rhythm, cardiac failure, chronic, acute left ventricular failure, agonal rhythm, which is severe arrhythmia generally occurred at the end of life, pulmonary infarction, cerebral artery occlusion, aortic stenosis, sudden cardiac death, hypertensive emergency, basal ganglia stroke. Now these aren't minor. Remember, we're always told, adverse events are rare and minor. These are not minor adverse events, and these safety signals were showing, and they were strong, but they were being hidden because FDA officials refused to acknowledge that the current system they were using was invalidated, and they had to look at the new system that unmasked these things. Our report goes on to detail how federal officials refused to acknowledge these revelations or take action to warn the public. Instead, senior FDA officials repeatedly tried to stop Dr. Scharfman from continuing her work or communicating her findings outside of FDA. In September 2021, Dr. Marks informed Dr. Patricia Cavazzoni, the then director of CDER, that Dr. Scharfman, who was a CDER employee, quote, has been asked to cease and desist conducting her data analysis. Dr. Marks complained that Dr. Scharfman's work had become, quote, a major distraction, that her efforts could create erroneous conflicts that feed to anti-vaccination rhetoric.
We'll be back in just one moment. You're listening to Crosstalk on VCY America.
Back
Back to Genesis with Dr. John Morris, scientist with the Institute for Creation Research. Dr. Morris, as unique as the giraffe is, how did it get its long neck?
Chris, an evolutionary story has it that during drought, those animals with long necks could eat leaves higher up in the trees. They survived while the others went extinct. Even though this story is told and retold in evolutionary circles, it's not even a little bit true. The giraffe has many precise design features to support its body style. For instance, a heart which will pump the blood all the way up to the head and then traps in the blood vessels to keep the head from exploding when the giraffe puts his head down to drink from the lake. There's much more to a giraffe than just a long neck. Everything about him is designed to be just this. Modern-day giraffes are very well adapted to the environment to fill an ecological niche. They were designed to do so. They did not evolve. And that's how I see it from a back-to-Genesis perspective.
For more on Genesis, visit us on the web at icr.org.
This is Crosstalk on VCY America. Little national attention given to this hearing that was last week, Wednesday. Senator Ron Johnson, chair of the committee. This is a permanent subcommittee on investigations under Department of Homeland Security. And he held this hearing called Unmasked, How Biden Health Officials Purposefully Turned a Blind Eye Toward COVID-19 Vaccine Safety Signals. Senator Johnson's going to wrap up his comments here within about 2 minutes, and then we're going to go to Senator Blumenthal, who is the ranking member, that's the lead Democrat on this committee, with his rebuttal to this issue as well. But let's continue on with Senator Ron Johnson.
Dr. Peter Stein, the then director of CDER's Office of New Drugs, reported to Dr. Marks that his office had, quote, made it clear to Dr. Scharfman, quote, that she should not be discussing and providing internal analyses externally and needs to focus on her assigned work. Dr. Scharfman, who retired from the FDA in 2025 after more than 35 years of service, told PSI staff in a recent interview that she believed her FDA colleagues saw her as a, quote, pest and, quote, persona non grata, unquote, because she was raising concerns about masking. Our witnesses today are medical researchers and experts in scientific data collection. They will help clarify the masking issue and describe why this cover-up was so egregious. I want to thank them for their time and effort they put into our testimony. I also want to thank Secretary Kennedy for his commitment to radical transparency and for promising to make HHS personnel with knowledge of these events available for interviews with subcommittee. And I also want to give a huge shout out to my staff. These are the folks who found a needle in a haystack in a document production from one of the universities that we were investigating 2.5 years ago. Found that David Morin's email where he was talking about being able to, being told how to make emails disappear and to use his Gmail. So these are the folks who did that, and these are the folks who have combed through 11 million pages to find and discover this egregious cover-up. So thank you guys. And
then he next introduces the ranking member, Senator Richard Blumenthal. He's the lead Democrat on the committee who kind of rebuts what he's talking about, but points to former, at that time, then President Trump, having been the one to bring about Operation Warp Speed. Here's Senator Blumenthal.
Thanks, Chairman Johnson. Amid everything that's been said, I think we ought to remember what it was like during the height of the COVID pandemic. Literally, the fear, the death, the loss, and then the relief as a result of Operation Warp Speed, which President Trump ordered, in having a vaccine that gave people hope and many people life. At the same time, none of the relief or hope enabled loved ones to come back. They lost lives, and families had their lives upended, and we can never forget the heroes in our healthcare system who braved COVID in delivering care to people who needed it in hospitals, many of them for weeks, sometimes months. We are fortunate to have with us Maria Young. Thank you for coming here today, who spent many days in a hospital, close to 70 days in intensive care. Most lives were forever changed as a result, but the vaccine offered a path forward for so many people, and we should be thankful for Operation Warp Speed. In January 2021, more than 20,000 Americans were dying each week from COVID-19. Between 2020 and 2025, more than 1.2 million Americans lost their lives to COVID-19. That's 1.2 million parents, children, friends, loved ones. And those deaths changed not only their families, but their communities and our nation. Husbands lost wives, parents lost children, and in addition to those who perished, millions were infected, and many of them suffered life-changing injuries from the virus. And employers suffered economically, as did our overall economy. And the survivors still bear, many of them still bear the scars of that experience emotionally, if not physically. Years of scientific analysis have shown that COVID-19 vaccines saved lives and prevented serious illnesses like the one that Ms. Young suffered. I don't agree with President Trump on a lot, but I have to give him credit for the work that was done to create COVID-19 vaccines in record time. But instead of talking about the success and remembering the ones we lost, vaccine opponents have turned one of the greatest scientific breakthroughs in our country's history into fodder for political attack. I don't get it. Today's hearing purports to discuss a cover-up of side effects of the COVID-19 vaccine, as if serious flaws in vaccines were purposely ignored. And let me be clear, they were not ignored. They were not disregarded. They were not covered up. The majority's report cherry-picks emails and misconstrues an internal debate between scientists who were actively looking for ways to detect side effects to support a predetermined and flawed thesis that COVID-19 vaccines have done more harm than good. That's not the scientific method, to have a preconceived result and then frame the evidence to fit the outcome. The report and documents that the majority has released simply do not support the notion of any kind of cover-up, nor do the reports and documents do anything to change our understandings of the vaccines as safe and effective. These points are important for the public to understand. And with all due respect, nothing that Chairman Johnson has released shows the vaccines were linked to any adverse effects beyond the rare ones that health officials have acknowledged. Indeed, the risk of stroke he claims was hidden not only was studied openly, but later shown not to exist. Without objection, I would like to enter into the record the 4 studies demonstrating that COVID-19 vaccines and boosters save lives, Mr. Chairman.
Without objection.
There is also a really deep irony in the majority's argument, given the current administration's overt effects to skew science and undermine public health. Last week, I wrote to the acting CDC director, Dr. Jay Bhattacharya, about reports that he has blocked publication of a recent study showing that COVID-19 vaccines were extremely effective at preventing hospitalizations last winter. That study still has not been formally released, although I understand that a copy was somehow leaked, literally hours before this hearing, magically released, but not officially. And therefore, I call on the CDC director to officially release that report. Again, I ask my letter to him to be entered into the record if there's no objection.
Without objection.
I sincerely hope we never face another pandemic. I think most Americans join in that hope. And that we are still able to find dedicated scientists and, yes, pharmaceutical companies willing to work around the clock to find vaccines and cures, and public officials who are willing to support and encourage and to fund them with resources. I fear that this administration's actions to politicize science and slash scientific funding and to expel talented scientists are doing irreparable harm to our nation's ability to counter the next pandemic. The threat remains real and present, and we must respect science and encourage our scientists to continue to do their work. Thank you, Mr. Chairman.
Thank you, Senator Blumenthal. Before we swear in witnesses, I'd like to enter a number of records into the record. First, the majority staff interim report and the 596 pages and 10 spreadsheets that support that report. Second, my December 15th, 2025 letter to HHS Secretary Kennedy requesting information about an internal FDA memo on deaths of children following COVID-19 vaccination. Then my March 23rd, 2026 letter to Secretary Kennedy detailing the subcommittee's findings about masking and how federal health officials ignored and downplayed the risk of ischemic stroke following vaccination of Pfizer's COVID-19 bivalent booster. And finally, the 2010 report entitled Electronic Support for Public Health Vaccine Adverse Events Reporting System. Again, this is the what they call the Pilgrim study done by Harvard. So I'd like to enter those in the record.
And he did that, and then was going to be introducing the next witnesses. But very interesting about Senator Blumenthal, and just saying, that no adverse events. And yet I'm right now on the openvaers.com website, and that reports the adverse events dealing with the COVID shot. And they are reporting 39,077 deaths. That indeed is an adverse event. Hospitalizations, 222,549. Urgent care visits, 157,841. Over 250,000 doctor's office visits. Anaphylaxis, 11,004. Bell's palsy, 18,009. Miscarriages, 5,219. Heart attacks, 22,507. Myocarditis and pericarditis, 29,200. Permanently disabled, 74,638 individuals. Again, friends, I'm reading from OpenVAERS. That's openvaers.com /COVID-data. There is, they report another 41,680 life-threatening conditions. Severe allergic reactions, 47,675. Shingles, 16,462 adverse events as a result of the COVID shot. So very interesting information. We are going to be taking a break here momentarily. And when we come back, we're going to be hearing from a couple of witnesses, Dr. David Wiseman, and then also a Dr. Karl Jablonski, who testified at this hearing as well. So Senator Johnson will be introducing them with their credentials. This is excerpts from a hearing that was held just last Wednesday, unmasked, how Biden health officials purposely turned a blind eye toward COVID-19 vaccine safety signals. We're going to take a quick break. We'll come back to those two doctors and their testimony coming up in just a moment. This is Crosstalk on VCY America. James 4:14 poses this thought. For what is your life? It is even a vapor that appeareth for a little time and then vanisheth away. Have you ever stopped to consider where you will spend eternity? You may say, but I'm a good person. I care for my family. I feed the poor. I stand up for life and traditional values. While all of these things are good, they fall far short of God's standard. Every one of us has a sin issue that must be dealt with. Our sin separates us from God, and each of us deserves to be eternally removed from God in everlasting punishment. But out of God's great love, he sent his Son, Jesus Christ, to bear our sins, shed his blood, die on the cross, and rise again. He is the only way of salvation, and it's imperative for you to place your trust in him. If you're wrestling with this issue, we'd like to send you a complimentary leaflet, Where Will You Spend Eternity? To receive a copy, just ask for it when you call us at 1-800-729-9829. 800-729-9829. Well, friends, we need a couple of full crosstalk programs to get all the information in, and we don't have that time available to us, but we are going to go back to the committee hearing and hear from two medical doctors, Dr. David Wiseman and then Dr. Karl Jablonski. And Senator Johnson's going to be introducing them, and we'll be sharing, first of all, the first doctor here, and this is Dr. Wiseman.
Our first witness is Dr. David Wiseman. Dr. Wiseman is the president of Synekion. Did I get that close? Pretty close. Synekion. There you go. I actually practiced that beforehand, and I still blew it. An R&D company focused on fibrosis and pain. He received his PhD from the University of Manchester and has a background in experimental pathology, pharmacology, and immunology. From 1987 to 94, he worked at Johnson & Johnson, rising to the position of research fellow, leading a program that included pharmacovigilance. Dr. Wiseman has published in numerous top scientific journals, including the Journal of the American College of Surgeons. Dr. Wiseman.
Distinguished Chairman, Ranking Member, and committee members, with today's stunning revelations, I am humbled to discuss critical flaws in statistical safety signal and potential risk detection in VAERS. Touted by CDC as the nation's early warning system for vaccine safety, and credited by former CBER Director Marks with detecting both potential and actual safety issues and informing vaccine policy decisions. Among limitations undermining detection of statistical safety signals is the problem of masking. Masking occurs when statistical signals for one vaccine in a database are obscured by reports associated with other vaccines. For example, Moderna's myocarditis signal becomes hidden if its comparison baseline is artificially inflated by including Pfizer's myocarditis signal reports. In a simple analogy, hemlock and arsenic appear equally toxic when compared separately with a non-toxic baseline control such as tea. However, if hemlock's baseline data include arsenic data, hemlock's signal is drowned out or masked, appearing innocuous. Today's report shows that senior FDA staff were apprised of the masking problem both prior to COVID vaccine rollout and repeatedly by Dr. Anna Schaafman. Dr. Schaafman is a veteran FDA statistician lauded for bringing the empirical Bayesian method into FDA after collaborating with its inventor and developer of the associated Empirica signal software, Oracle's Dr. William Dumichel. Schaafman communicated Dumichel's findings of extreme masking, including death, myocardial infarction, stroke, and dementia, noting that I am not astonished that FDA's analysis was unable to detect these signals. She repeatedly advised colleagues of Dumichel's improved procedures, not brand new, they'd been around a while, to address masking in the same Empirica signal software used by FDA and commercially available. Nonetheless, officials attempted to contain Dr. Schaafman, asking her to cease and desist. Elsewhere, officials claimed ignorance on how to address masking and that developing solutions exceeded FDA's capabilities, considering it problematic to use a brand new possibly unvalidated tool in the context of an EUA. FDA had validated methods adaptable to demask signals. In a special data run in the new documents, FDA's Dr. Menschik found a muting trend yet to appear in the record. In the related PRR, or proportional reporting ratio analyses required of them by the VAERS standard operating procedure, CDC somewhat accounted for masking. In 2022, Schaafman and Dumichel published in the leading journal Drug Safety their masking concerns and the improved method, unmasking hundreds of statistical signals for the COVID vaccines, consistent with my analysis. Despite possessing both software and in-house expertise, regulators failed to implement this solution to correct for masking, a striking failure given the accelerated population scale deployment by Operation Warp Speed of a novel and most complex class of drugs ever, mRNA. Compounding further, CDC considered that its PRR analyses were rendered basically redundant by FDA's Bayesian work, discarding its responsibility to generate these PRRs. Accordingly, the United States lacked a fully functional early warning system at the time of its greatest need. Separately, statistical signals were trivialized by avoiding the terms signal or potential safety signal. These failures are incompatible with the so-called enhanced surveillance required by VAERS standard operating procedures. Hindering investigation of potential risks, FDA was obliged to consider, even without having to prove causality, and impugning vaccine injury compensation, authorization, and approval decisions, principle of which was Comirnaty's hastened full approval undertaken while Dr. Schaafman was voicing her concerns. Further, they marginalized those apparently injured by COVID vaccines. Not only did the system fail to perform as advertised, but as the drug safety paper presciently warned, the COVID vaccine reporting deluge likely created masking effects that now compromise signal detection for other vaccines going forward, and there are several papers that describe this. Regulators must swiftly correct masking and other VAERS deficiencies, heeding earlier warnings of their former colleagues, Drs. Marks and Jernigan, who said, failure to detect and communicate a serious health issue related to vaccines could impact confidence not only in COVID vaccines, but in all vaccines. Thank you. I welcome your questions.
Okay, so that was his testimony, and then also we had the testimony that came from Dr. Karl Jablonowski, and as the senator is going to introduce him as well. And let's get that clip here ready for us. Here we go.
And our next witness is Dr. Karl Jablonowski. Dr. Jablonowski is the Director of Science and Research at Children's Health Defense. He holds a master's degree in computer science from the University of Chicago and a PhD in biomedical and health informatics from the University of Washington School of Medicine. His research focuses on bringing about an end to childhood health epidemics. Dr. Jablonowski.
Thank you, Chairman. Pharmacovigilance is absolutely necessary. Our knowledge is limited, even of a vaccine that passes clinical trials of a few thousand very healthy people. We simply do not know what adverse events look like in a diverse, large population until they're administered to a diverse, large population. We had better be watching very closely, which is pharmacovigilance. The vaccines, by honest accounting, were pathetically tested. Pre-EUA, no drug-drug interaction study, no cardiovascular toxicity, central nervous system toxicity, other organ toxicity, blood toxicity, genotoxicity, carcinogenicity. Had they actually turned out to be safe, it would have been serendipitous, a happy accident. Luck is not a pillar of public health. Pharmacovigilance behind closed doors should give everyone pause. It is simply too important to not do it correctly. Lapses can be and were catastrophic. The vigilance heavily depends on three sources of data: the passive surveillance of VAERS, the active surveillance of vSafe, and the VSD, an active system linked to medical records. vSafe was designed to collect inconsequential data. One of the first papers to publish it was a mortality and adverse event study. The only figure in the entire paper was a time series comparison for both Moderna and Pfizer, for both dose 1 and dose 2 of adverse events no one cares about. Injection site pain, fatigue, headache, myalgia, chills, and joint pain. Dr. Renata Engler is distinguished in the study of vaccine-induced myocarditis among U.S. military with 4 publications on the smallpox vaccine. On the CDC not including myocarditis in vSafe, she asked, "If you do not ask, you will not see it. But does that mean it does not exist?" Within 50 days of that meeting, Dr. Engler would start adding 4 more publications on COVID-19 vaccine-associated myocarditis. The CDC already had in hand Israel's slides. The vSafe system had 10 million volunteers. About 1/3 entered free text. Perhaps there is some horror found in the 366 individuals who typed in myocarditis, a condition requiring medical diagnosis. That is amplified by the nearly 50,000 people who typed in chest pain. The Vaccine Safety Data Link is a collection of 13 healthcare organizations covering 15.5 million people. It can detect safety issues within a few weeks. Most frequently used is rapid cycle analysis, which can miss delayed onset events. Better and timely options, like the vaccinated versus unvaccinated or pre-post, is rarely used. And they would need the well-practiced extra step of considering differences in healthcare-seeking behavior. By the time the CDC's webpage was updated to warn of inflammation of the heart, 313 million doses were administered to 173 million people. I do not see vigilance at work. With VAERS, the CDC chose to ignore its own standard operating procedure and not run proportional reporting ratios in favor of the FDA's, what Walensky calls more robust and Shimabukuro calls the gold standard. VAERS had been grossly underreported for the first 30 years, maxing out at 58,000 reports. In its 31st year alone, VAERS logged 18 times that number. Because of this disproportionality, the FDA's disproportionality analysis was washed out. Since both vaccines were of the same platform and same adverse events, the comparison was muted. This isn't a blind spot. The FDA was completely blind to adverse events, and the CDC wasn't even looking. There was a savior in the ranks of the FDA who correctly identified the problem, appropriately worked with the inventor of EB data mining to create a solution, communicated the fix to everyone who would listen. The problem is, no one listened. Luck was not on our side. The CDC failed to look. The FDA failed to fix a broken system that the CDC touted as the gold standard. The HHS failed to protect us, especially after our freedom of choice was assaulted by the president threatening us all with, "Our patience is wearing thin." FOIA evasion was well practiced and discovered, obviously, not through a FOIA. Simply put, during the largest pharmaceutical rollout in human history, pharmacovigilance did not exist. That is the betrayal of our time, so vast that we cannot even count its casualties.
So that is the medical doctor as well, Dr. Karl Jablonowski, as he testified at this hearing as well. We're hearing excerpts from a hearing that was held last week, Wednesday, unmasked how Biden health officials purposefully turned a blind eye toward COVID-19 vaccine safety signals. We have one last segment left. I'll introduce it right after the break. But in this, Senator Johnson indicates that Peter Marks, who's head of the FDA Center for Biologics Evaluation and Research, was treating vaccine injuries that were life-threatening to people and pleading with the FDA and the NIH to make this public, but this man never did. And so Senator Johnson indicating we got a big problem here. These vaccine injuries are real, but it's being denied. We're going to take a quick break, and then we'll introduce this last segment right afterwards. You're listening to Crosstalk on the VCY America Network.
For the Worldview Report, I'm Brennan House. Our website's worldviewtube.com. Over the weekend, I was studying Romans chapter 1, but I was also studying Daniel chapter 4, where Nebuchadnezzar, due to his pride, he's forewarned by Daniel, repent. I don't want this to happen to you. But he wouldn't. A year later, after being warned, God causes Nebuchadnezzar to become like a wild animal, grazing on grass. In fact, Romans chapter 1, verses 21 to 23 speaks of this. They have become fools. That means vain, useless, or futile in their nature. And they have taken the glory of the incorruptible God and turned it into an image made like corruptible man. And they worshiped what? Birds and four-footed animals and creeping things. You know what I found interesting? That's exactly what Nebuchadnezzar was doing. Now we have so many people identifying as animals today, or as furries, or what they are calling people that practice what is known as Therians. Is this part of God's judgment?
You're listening to Crosstalk, special program today because this has not gone out across the nation as it ought to. This is a hearing held last Wednesday. Senator Ron Johnson of Wisconsin, Permanent Subcommittee on Investigations, and he had a hearing called Unmasked, How Biden Health Officials Purposefully Turned a Blind Eye Toward COVID-19 Vaccine Safety Signals. The next guest, whom we're not able to play the comments due to time constraints, was Maria Young. She was there at the behest of the ranking member, the lead Democrat on the committee. She is a COVID shot advocate, and she described the horrible experience that she had with COVID and not expected to recover, went through great physical suffering, but came through, thanked her doctors, her nurses, and therapists, and now says she is current on COVID shots and boosters. And after she spoke, Senator Johnson then responded to this issue, and he also aired a video clip. If we have time, we'll get this in. But we did make one edit on the video clip, not of Senator Johnson, but of the individual speaking who used a vulgarity, and we're not going to play that here in Crosstalk. But let's go with Senator Johnson's response.
Thank you for sharing your story, Ms. Young. I would love to connect you with Breanne Dressen. Many of the things you said are exact same words I've heard from the COVID injection injured. These people were healthy, they were active, now they're permanently disabled. When I first met them, held our first event in Milwaukee, all they wanted was to be seen, heard, and believed. That was their third. Seen, heard, and believed so they could get treatment. They still can't get treatment because they are not being acknowledged. I want to, once I introduce this video, I want to start my Q&A with a 1-minute video. But to set it up, this is a video of recordings of Zoom calls between the vaccine injured. And by the way, React 19, I think I read, they've got something like 40,000 active members. They probably would have more if Facebook hadn't been shutting down their support groups, leading to suicides among those, lack of that support. But this is actually a note in terms of what this video describes here from Breanne Dressen. She writes, beginning in March 2021, seriously COVID-19 vaccine-injured patients were flown to NIH, and this was March 2021, the same time they were made aware of the fact that they were going to mask the safety signals using the algorithm. Vaccine-injured patients were flown to NIH headquarters for extensive testing and evaluation and treatment. Study participants, and I think there are about 23 of them, study participants received credible diagnoses, including, quote, post-vaccination neuropathy. Again, they were diagnosed as vaccine injured. And specialized treatments the participants say saved their lives. They were incredibly grateful that the NIH, people like Dr. Nath, were paying attention to them and treating them and improving their severe injuries. That same month, NIH researchers began promising participants that the study and their injuries would be made public. And apparently the email where that promise was made was also copied to Peter Marks and acting FDA Commissioner Janet Woodcock. The NIH then asked participants to remain quiet, say nothing, until they disclosed the study themselves. They complied. They feared if they were to go public, they'd lose the treatment, that all the thousands of other injured that we're counting on them to be studied, to develop cures, wouldn't receive treatment either. So they stayed silent, holding on to the promise that help is coming for the many others nationwide. That study and the injuries were never disclosed to the public. They were lied to. And this video, again, read my report. Senator Bloom, I cannot believe you read my report based on your opening statement. Read my report. It is irrefutable. But the video is of Peter Marks, head of CBER, the man who was notified on March 1st, 2021, that the safety surveillance system that they were going to use to detect those rare and mild safety signals was invalid. It was going to mask those. It was going to hide those very safety signals. Again, 26 days later, a state-of-the-art system showed 25 safety signals, and I read how severe those adverse events were. But just listen to what Peter Marks, with the knowledge that he was treating vaccine injury, and they weren't mild injuries. These were life-threatening injuries. These were total disability type of injuries. So he knew it. He was treating them. He knew that his safety surveillance system was masking these signals. They lied to them. Listen to what Peter Marks had to say. This is about a minute-long video.
There is incredible out there about like thousands of people dying, etc. That just ain't true.
No one's denying that adverse events can occur. That doesn't mean that any given individual might not have had something related to the vaccine. I'm not denying anything. The issue is that the number of cases have not risen to a number that leads to a clear differentiation that it's a signal. There's not a clear signal. It just says that we don't have a signal. We continue to query the various databases. The large databases still have not seen a signal.
You couldn't really tell. You just couldn't tell whether there was a signal or not. It's something that's been reported, but not as something that is clearly vaccine related.
You guys know we exist. We know that you know that we exist, but the public doesn't think that you guys know that we exist.
That was Brianne Dressen.
And indeed, this was a hearing last week, Wednesday. Senator Ron Johnson, thank you for putting this together. From the New York Post, the indictment of Dr. Anthony Fauci's former advisor David Morans a week ago Tuesday revived calls for the Justice Department now to prosecute Fauci himself for allegedly lying to Congress about funding risky research in China before the COVID-19 pandemic. Critics say Fauci bears the most responsibility and should be hauled into court. 99% of this country has no idea who Morans is, said Oversight Project Manager Mike Howell. It's Fauci they will blame for one of the worst government catastrophes in history in America, and so the test is Fauci. Evidently, there's a 5-year legal deadline that happens on May 11th to indict Fauci for denying under oath that he funded gain-of-function experiments that modified the bat coronaviruses in the same city where the pandemic started. Well, friends, we brought this to you as a public service to hear what most of the country has not heard, and that was a hearing unmasked how Biden health officials purposely turned a blind eye toward COVID-19 vaccine safety signals. Thanks for joining us today on Crosstalk.
You've been listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Tape Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208, or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.